Hello, the next series of exercises I am going to do is for shoulder pain patients. So if you have frozen shoulder or any kind of shoulder pain, these would be the best exercises for you. So the first exercise that we're going to do is a postural exercise, but before we do that, I want you to understand why these exercises, why this posture is so important. Okay, so Kat, I want you to face me. And what I want you to do is I want you to hold this, keep your arms like that, and I'm going to push your arms down. Do not let me push you. Like hold yourself. And when I do this, she's actually moving forward and she's losing her balance. She was better, but if I did it on a regular client of ours, they actually step back or step forward and they lose their balance. So now I'm going to correct her posture. So I want you to stand up and I want you to figure out where your neutral pelvis is. In order to do that, you have to completely tilt your pelvis posteriorly and then anteriorly and then come right to the middle where it feels comfortable and it's in the middle of that range that you have. Now I want you to maintain that range. When you're in this range, you're actually going to find that your core muscles are engaged. Do you feel that? You feel that? And do you also feel that your knees are not locked? In fact, they are kind of loose. Do you feel that?
Yeah.
Okay. So if you're locking it, you're actually arching your pelvis. So when the pelvis is in neutral, your knees are soft and your core is engaged. So maintain that, do not let go, okay? The next thing I want you to remember is your sternum. This is your sternum, and if you have eyes on your sternum, right now your eye of the sternum would be looking right there. So I want you to lift your sternum up so it's looking up or parallel to the ground, okay? So see what happened. Come back. I want you to notice this. So when you were like this in the beginning, now I want you to lift your sternum up. So when she lifted her sternum up, her shoulders actually went back. So I have noticed that patients end up doing this, and that's not what I want them to do. I want them to lift their sternum, and that actually positions your shoulder in a better alignment than trying to do this, because that's not what you should be doing. It's not feasible for you to do that all the time. So now your pelvis is in neutral, your sternum is lifted up, and all I want you to do is push your head back just a little bit, okay? And when you do that, and I'm going to repeat this test so that you know there's a difference in how you feel. And I hold it down like that, and now I'm pushing really hard and she's not moving. We didn't do any kind of strengthening exercise. She just became stronger by using the postural muscles correctly, by standing in a better posture. And that's why this exercise is really, really important. So if I have to break this down into an exercise, I'm going to ask you, I want you to keep your feet hip distance apart. So to know hip distance apart, this is what you're going to do, okay? So keep your feet together, you're going to go out to the side, and then you're going to lift it and put it in. So now your feet is hip distance apart. And now I want you to remember the neutral pelvis we talked about. Find your range of your pelvis and come back to the middle of the range. And that is your neutral pelvis. And when you're in neutral pelvis, you should feel that your core is engaged. You should also feel that your weight is shifted equally between the big toe and the little toe and the heel. So I want you to make sure that you're grounded. You have to feel the weight on the ball of your big toe, the little toe, and the heel equally, and your pelvis is in neutral. So maintain that position. And then I want you to lift your sternum up. When your sternum's lifted up, you're going to feel that your scapula in the back, the shoulder blade is kind of squeezed slightly, Not a lot, just slightly, and your shoulder is actually sitting back where it needs to be. Now I want you to keep your head back, just like that, and maintain this position for a count of 10. But instead of just holding it in this position, we could do a dural stretch by doing a chin tuck and counting 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And now we're going to do it again. Maintain that position, neutral pelvis, which means if you are arched like that, I would want you to do a slight tail tuck, but not too much, just a little bit. Okay, so neutral pelvis, lift your sternum up, head back, and now do a chin tuck. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax, and we're going to do that 10 times. You did 2 already. So, neutral pelvis, sternum lift, head back, chin tuck. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Same thing, keep going. Tail tuck, sternum lift, head back, chin tuck. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. Again, neutral pelvis, sternum lift, head back, chin tuck. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, neutral pelvis, sternum lift, head back, chin tuck. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Again, neutral pelvis, sternum lift, head back, chin tuck. 1, 2, 3, 5, 6, 7, 8, 9, 10. And same thing. Neutral pelvis, sternum lift, head back, chin tuck. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One last one. Neutral pelvis, sternum lift, head back, chin tuck. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And when you do this, you're actually using all of your postural muscles plus doing a standing dural stretch for your spine. Thank you.